between Shea Gilgeous-Alexander and Quade Green. Here's Cal on what he's telling those two, as well as how impressed he is with the improvement of one of his veterans.
Shea did some good things. You know, all I'm telling Quade, do not hold the ball. Do not hold the ball. Get rid of it, and he can shoot. So now we'll get you shots. You be the guy away from the ball. And if it comes to you and you get in the lane, that's great. So, you know, we've got to narrow into how we're going to play. I thought Wenyon worked hard the whole time and tried and made shots, and he's way better than he was a year ago. I think you see that. But we're going to have to see.
And that's all we have for you in sports this morning. Until later tonight, I'm Brian Kennedy for ABC 36 Sports. Have a great day, Kentucky.
Well, Midday Kentucky's Troy Thompson is out at Dr. Gina Johnson-Higgins' dental office with information on sedation dentistry.
This is something really important, especially if you have anxiety over dentistry. So let's check in with Troy.
Hey, Katie. Well, thank you, everyone. We're over here at Dr. Gina Johnson-Higgins, of course. How are you, my friend?
Good morning. It's a beautiful rainy morning in the bluegrass.
It sure is. Now, we're talking about sedation dentistry, and there are a lot of miscommunications when it comes to what is sedation dentistry to begin with. So let's answer some of those questions for our viewers out there. So what is sedation dentistry?
For some patients, they don't want to know what we're doing. They know they need treatment. You know, bad things happen to good people every day. You have cavities, you break a tooth, you want some cosmetic work done. Anything, any reason. You know, if you're afraid, if you're too tense, if you just need a break, you can do sedation dentistry, and it's very safe, it's very easy, and you wake up and your treatment is complete.
Well, it's funny you just say wake up. I want to ask you, are you put to sleep like you are in a hospital, like an anesthesia?
Well, it is a type of anesthesia, but it's not like the hospital. You're always breathing on your own. You never have to have a respirator. It's a very light, at one point they called it a twilight sleep.
Oh, of course.
Where you actually can respond to commands. You still know a little bit of what's going on, but you don't care.
I got you.
It's very restful.
Some of the things, would you have sedation therapy for maybe just a dental clean, or is it a little bit more, you know, work that is a little bit more aggressive as such?
For some patients who have extreme dental phobia, we do sedate them for cleanings.
Really?
And if you have severe gum disease and you have to have periodontal therapy, we definitely sedate you to catch you up on your cleanings so that you can have regular cleanings again.
Okay, well, talk to me about that. Now, if we were having implants or things like that, we're going to talk about that a little bit later on as well.
Yes.
But is there different recovery times depending on the type of sedation that you do?
There are different recovery times. The sedation in the hospital, you need a few days. Sedation here in the office, I do suggest that you have at least a day to feel normal again, because you are sleepy. It's great sleep, it's a great rest, and you are having dental treatment, so you may be a little bit sore, but you're not out for a week.
Okay, can I ask you, we talked, you know, what is sedation, but what's the form of sedation? Is it a Valium as such?
Well, we do a pre-treatment sedation at home, so that you're not tense when you get here, but we do IV sedation and inhalation, happy gas. Happy air makes you happy.
Happy gas, happy dentty, happy life.
Yes, yes. and there are all different forms, and we use those in combination. I did a lot of extra training to be able to tailor the sedation experience to what you need.
Well, we appreciate you again, Gina, and we're going to be back in the studio right here talking all about more sedation therapy, and I think we've got a surprise guest as well. Ladies, back to you in the studio.
Thanks, Troy. I love how they offer so many different options just from the mild sedation, because I know I get a lot of anxiety going to the dentist.
Well, sometimes it's a little nerve-wracking, but what also helps is Dr. Gina is such a sweetheart.
Oh, I know. She's so nice.
That really helps too.
Yeah, she's amazing. We'll be checking back in with Troy throughout the show. But up next, if you like the classics, Little Shop of Horrors.